Hello, and welcome to this week's edition of NHIS in a Week. Here, we bring you a recap of happenings within the authority and the scheme. My name is Lucy Texan Kofi. Now the headlines. NHIS clears 834 million in claims. NHIS CEO inaugurates task force to tackle illegal NHIS charges. NHIS CEO outlines bold vision to revitalize the scheme. To our first story, the National Health Insurance Authority is stepping up its fight against illegal charges under the National Health Insurance Scheme. In a bold move to restore public trust, Acting CEO Dr. Victor Asari-Bampo has inaugurated a dedicated task force to investigate and eliminate co-payment across the country.
At the NHI head office in Accra, a 4-member Claims and Co-Payments Committee was inaugurated. The committee's clear mandate is to investigate and eliminate co-payment and other illegal charges under the NHIS. The committee, chaired by Dr. Francis Asenso-Bwedi, Director of Provider Payments, is expected to provide practical solutions to a long-standing challenge. Dr. Bampo emphasized the urgent need to restore public confidence in the scheme, calling for commitment, precision, and innovation in tackling the issue.
We're looking to you to make this work, and we hope that it will not be said that, oh, this is just another task force. We expect that you would look at the causes of these co-payments. You would look at how we can design various mechanisms to bring them to a stop. We expect that you would look at how we actually eliminate it so that it doesn't happen anymore, and how that will affect the work that we're doing and the confidence that we bring to the scheme. We have every confidence that you will be able to do this and do this well.
Top executives, including Dr. Senanu Jokoto, Mr. Raphael Sekbeb, and Ms. Bogobiri, all supported his call and underscored the importance of learning from the past while driving forward with renewed energy.
As you will recall, we've been down this road before. We had a committee that was tasked to do exactly what we are tasking you to do today. Incidentally, it was chaired by Dr. Asenso, if I'm right. And then we had membership drawn from across the country, including, I think, district managers and regional directors. I don't know what happened, but I believe we have learned some lessons from what we could have done right, what didn't go well, and based on that, I expect that we should be in a position to correct what didn't go well or what we could have done well, so that we deliver this time around.
Moving on. In his first major press briefing since taking office, Dr. Bampo laid out a bold and focused vision to re-energize the National Health Insurance Scheme and restore confidence in its operations.
Speaking to the media at the NHIS head office, Dr. Bampo unveiled a 3-point agenda focused on improving claims efficiency, restoring public confidence, and aligning with national health policies like free primary health care and Mahama care.
I want to tell you a little bit about my vision for the NHI. And this trickles down from the President's vision of universal health coverage, of universal free primary health care, and also Mahama cares, which is so that's the President's vision. How do we translate it at our level? Number one, we want to make sure that as NHIA, we are doing exactly what we were set up to do, that is to pay claims. The second big thing is to bring back the confidence in the scheme. And this is by working hard to eliminate out-of-pocket payments, the illegal payments. The third part of the vision is the Mahama cares and the free universal primary health care that I talked about. So these are the things that I think we want to look at.
He announced that a greater percentage of NHIS inflows will now go directly to paying claims, targeting 65% in year 1 and 70% in year 2.
We want to ensure that in year 1 of my tenure here, at the very least 65% of the funding that is given to us goes to pay claims. And by year 2, we want to move it up to 70%.
Dr. Bampo made it clear that illegal charges will no longer be tolerated. The authority is scaling up monitoring and public education to end co-payments. With this renewed direction, the NHIA aims to become a more accountable, people-centered institution.
Moving on, in a major financial move, the NHIA has cleared outstanding and current vetted claims totaling over 834 million cedis, reaffirming its commitment to timely payment and the sustainability of healthcare service delivery.
Dr. Bampo announced that in just 1 week, the authority paid 555 million Ghana cedis to healthcare providers, with just a small amount of 30 to 40 million Ghana cedis in processing.
For this year, we've paid claims of up to 834 million cedis. And over the past week, we paid, I think, 555 million cedis. So all the vetted claims that we have in the system, we've paid. And I think there's about 30 or 40 million that we're still paying. So that is the short answer. I mean, all the claims have been paid.
The CEO noted that this achievement was made possible by the recent uncapping of the National Health Insurance Levy. But it's not just about clearing debts. The authority is also tightening internal systems, reducing inefficiencies, and enforcing accountability through a newly formed co-payment task force.
We are working hard to eliminate out-of-pocket payments, the illegal payments. Later on today, we are actually inaugurated a committee of high, senior level directors that have put together to look at this issue. I know all my predecessors have worked on this, and they've taken it to a certain level. So we're not starting from scratch. We're taking this information, but we're going to move at it drastically to try and minimize and eliminate it so that people have the confidence to use the NHIA cards without feeling that they would be sort of forced to get some funding. I talked earlier about making sure that we tighten the internal controls so that if there are any leakages, these are minimized and eliminated if we can eliminate them. Financial, all the leakages that you can think of. Let's see how we can minimize them.
Director of Corporate Affairs Directorate, Mr. Oswald Esua-Mensah, also urged the media to support the NHIA by monitoring healthcare providers who continue to demand illegal payments from patients.
You have a role to play in there, NHIA has a role to play in there. How we make the scheme attractive to everybody will also count back on you again. That when management is doing everything we can do internally, you would also support us, with the right optics, with the right messaging, right communication, to make people aware that the scheme is healthy, the scheme is growing, and the scheme is doing what it was set out to do. That will be support you can also give to us as we traverse this journey. Yeah.
In Koforidua, NHI's regional leaders met for a 2-day performance review meeting to evaluate membership growth, identify challenges, and set goals for 2025.
The Membership and Regional Operations Directorate gathered regional directors from all 16 regions to assess progress and refine strategies for improving NHIS coverage and service. Key topics include improving data quality, better coordination with healthcare providers, and new ways to increase public education and engagement. Director of MRO, Mr. Uti Frimpong, praised the regions for their commitment while challenging them to aim higher. The meeting ended on a high note with a shared commitment to deepen collaboration and support the authorities' new strategic direction.
And to our final story, the Research Policy Monitoring and Evaluation Directorate of the National Health Insurance Authority has completed a 3-day performance monitoring and assessment session focusing on the progress of Directorate's 2024 programs of work.
The RPME Directorate brought together monitoring and evaluation focal persons from across NHIA to evaluate the authority's progress in achieving its strategic goals for 2024. The session, chaired by Mr. Abbas Suleimana, Acting Director of RPME, allowed each directorate to present its end-of-year POW reports, highlighting key achievements, challenges, and lessons learned. With this performance monitoring, NHIA is poised to continue strengthening its health coverage efforts and delivering quality healthcare services to the public.
Let me rough off. I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be pedroni boarding.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith, eh? Listen, let me tell you, there's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the Power Fee, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes! You can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier. National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
This is how we round up this week's edition of NHIS in a Week. For more news, do log on to our social media handles displayed on the screen and also visit our website www.nhis.gov.gh. My name is Lucy Texan Kofi. Thanks for watching.